Hello, in this video, I'm going to talk about the movements of the eyeballs and the extraocular muscles that cause those movements. So the eyes can adduct and abduct. So adduction means towards the midline of the body, and abduction means away from the midline of the body. So when it comes to movements of the eyes, adduction means the eye is looking towards the nose, and abduction means the eye is looking away from the nose. So if using both eyes, you look in one direction, one eye is adducting and one eye is abducting, because one eye is moving towards the nose and one eye is moving away from the nose. Elevation is looking up, depression looking down, and then intorsion and extorsion are kind of the trickiest ones to describe when it comes to movements of the eyeballs. So intorsion is when the top of the eye moves toward the nose. So it's sort of a rotation of the eyeball. And extorsion is the opposite. Top of the eye moves away from the nose. So if you think about rolling your eyes, so if you roll your eyes, one eye is moving toward the nose and the other is moving away from the nose. So if you roll your eyes, one eye is doing intorsion, the one that's moving toward the nose, and one eye is doing extorsion. That's the eye that's moving away from the nose. So the muscles that are responsible, we call them extraocular, as in muscles that are outside of the eyeball that move the eyeball, compared to the intrinsic muscles of the eye that are smooth muscle inside of the eyeball that are responsible for changing the shape of the lens and the size of the pupil and so on. So the extraocular muscles, we have adduction, is performed by medial rectus. So 4 of our muscles here are named rectus, as in straight. So medial rectus, superior rectus, lateral rectus, and inferior rectus, those are all muscles that attach to the top bottom sides of the eyeball and pull in a straight direction. So medial rectus adducts and lateral rectus abducts. Then elevation and depression are a little bit more complicated because it depends on how much the eyeball is currently or abducted when the eyeball elevates or depresses. So elevation is a combination of actions of the superior rectus and inferior oblique. So that is this muscle down on the bottom here that is kind of sideways hooked underneath the eyeball. So those 2 muscles, superior rectus and inferior oblique, together cause elevation. And then the opposite, depression, is caused by inferior rectus and superior oblique. So superior oblique up on the top here, again, pulling sort of sideways. So depending on whether the eye is in a neutral position when we elevate and depress, or if it's abducted or adducted, that changes the relative contribution of each of those muscles during those actions. Then intorsion is caused by the pull of superior oblique, and extorsion is caused by the pull of inferior oblique. All right, thank you so much for watching this video, and I hope you have a great day.